You know, it's very interesting. When you look at surveys, and surveys ask employers whether or not they have a wellness program, it's almost 90% of employers would say, yes, we have a wellness program. I can tell you that's interesting as a consulting firm, because when we go and meet with many, many different employers, we know that that is nowhere near 90%. And certainly nowhere 90% are implementing the type of overall comprehensive population health management programs that can be used within an employer to change the risk of their population. Why are we even talking about this? The reality of it is if you're an employer, you recognize that healthcare costs are rising. And based upon what we're looking at right now, we do not see any end to that in sight. One of the few things and areas that an employer can really do something about is the population health of their group, and looking at not only the employees but the spouses and dependents, trying to integrate both disease management programs and wellness programs into a format that works for them as an employer, that's based upon their culture in a sensitive manner, but that also gathers enough information that allows you to manage the risk. There's a lot of cutting edge things that are happening out there, and we would encourage you to ask us about them. In fact, there are some types of tools, when integrated together, that can statistically predict with 85% accuracy the future large claimants on your group for the next 2 years. That can be very powerful when you know who the people are who are likely to be your high-risk claimants, because if you're able to get involved with a disease management program and an effective wellness program prior to their having the catastrophic event, you can have significantly lower healthcare costs. And really, we're always talking about the margin. If you're willing to do something that your competitors aren't, this gives you a competitive advantage in just one area that allows you to do a little bit better job than them. It's always on the margins, and especially when you're talking about population health, because there's so many different ways to get involved. So I'd encourage you to talk with us about it, and because there's so many strategies and different strategies coming up every day, and we'll help you find one that's totally suited for your company.